Hey everyone, welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about iron deficiency anemia. Okay, so before we talk about iron deficiency anemia, let's talk about iron and why it's so important. So iron is essential for making hemoglobin, and hemoglobin is the protein that's inside red blood cells that carries oxygen. So if you don't have enough iron, then we cannot form adequate hemoglobin, which means the body can't deliver enough oxygen to meet its needs, which is bad. So iron also does more than that, not just help hemoglobin. It also plays a role in making ATP, which is the energy currency for our cells. It's also involved in glucose metabolism and DNA synthesis. So let's take a look at where iron is absorbed. So iron is absorbed mainly in the duodenum and the top part of the jejunum pictured here. So you can already see if a patient has had some type of surgery where the gastric anatomy has been altered. Maybe they had cancer in the past and they had a piece of their bowels removed. They may have issues with iron deficiencies. That's just one example. So we do have iron stores in the body, and when we consume iron in our diet, our body's smart. It will keep what it needs and will let the rest of it pass on through. So the liver actually stores extra iron in the form of ferritin. When the body needs to make more red blood cells in the bone marrow, transferrin, which is a transport protein, carries the ferritin from storage to the bone marrow to make new red blood cells. So I hope these terms, if this is the first time you're hearing them, once you look at some lab work, it starts to kind of make sense. Okay, so let's now actually talk about iron deficiency anemia, or IDA for short. So if you looked at these cells under the microscope with a patient that has iron deficiency anemia, they are going to be hypochromic and microcytic. So that means their color will be paler and they're going to be smaller than your average red blood cell, okay? Hypochromic and microcytic. So the pathophys on this one. The body has extra iron stored up. So if you're experiencing iron deficiency anemia, that means your body has ran through the storage and now you are having a hard time making hemoglobin to carry oxygen. So IDA is the most common type of anemia, and the most susceptible to this is pregnant women and children. So that is because when you're pregnant, you need extra iron because the formation of a fetus takes a lot from the mom's nutrients. So if the pregnant mother is not taking a supplement, they can become iron deficient. And then children, toddlers, young children, they are growing, and as they grow, their body needs more iron. So they probably aren't going to get a lot of iron in their diet because it's in green leafy vegetables, it's in meat, organ meat, red meat, and children often don't have the best balanced diet. They might be a picky eater, so that could be also a reason why they become iron deficient. So let's look at the causes. First, we have poor intake. So you're just not eating enough iron, and with higher demands, like if you're pregnant or if you're a growing child, then you become iron deficient. If you're vegetarian, you might not get as much as you need in your diet because the best way to get iron in your diet is with red meat, specifically organ meat. Then we have our GI malabsorption. So you can be eating sufficient amounts of iron, but maybe you've had some type of recurrent inflammation like celiac disease or Crohn's disease that can affect your bowels, your intestinal ability to absorb those nutrients as they should. GI disruption, maybe you had surgery. The example I just gave, they resected a piece of your bowel. Now you don't even have that area that's supposed to absorb your iron. Blood loss. So if you lose blood, whole blood, then your body can't recycle that iron because it left your body. Heavy menstruation. If females have heavy periods, they are losing that blood. They can become iron deficient. Or blood donors. If you donate blood too frequently, you are going to become iron deficient. Medications. Some medications can block the absorption, like proton pump inhibitors, PPIs, antacids, aspirin, NSAIDs. So this is a clue for you as a nurse when you're asking, health history. You need to get a good medication history, and always tell your patients, tell me everything that you're taking, not just prescription medications, because sometimes patients don't think, hey, I bought this ibuprofen at CVS. I don't have to say that because the doctor didn't order it. So be very specific. So signs and symptoms, this is an anemia, so we're going to have those general signs and symptoms, including pallor, glossitis. So glossitis is, gloss refers to tongue, itis is like inflammation. So because there is lack of oxygen to the top layer of the cells on your tongue, they kind of react with this inflammation. So you get like this big shiny red tongue. So that is glossitis. Fatigue. So fatigue is a very good indicator, like I mentioned before, of not enough oxygen circulating. So if a patient says that they're very fatigued lately, you always want to consider anemia. And this is also a good indicator that they're starting to get better. So if they come back in a couple weeks after their plan of care, their interventions were given, their instructions, and they say, you know, I have more energy now, you can kind of think, oh yeah, they're getting better. Okay, so tachycardia, tachypnea, so this is the body trying to compensate for that lack of oxygen. The heart beats faster, you breathe faster, all trying to get more oxygen to your cells, tissues, and organs. Pica or pica, so this is when you are kind of attracted to eating inedible things, like ice. Sometimes, I mean, that's not inedible, but sometimes you crave ice, or people eat dirt, things that you're not supposed to eat, suck on rocks. So those things can be an indicator that you are vitamin or nutrient deficient, and it could mean that you are iron deficient. Changes in the nail bed, like this picture. So these are spoon-shaped nails, colunquias. This is severe IDA. This does not happen overnight. This is long-term iron deficiency. So again, anemia is a late manifestation of iron deficiency because we have iron stores in our liver, and it takes a while for our body to use all of those stores up. So I wanted to show you this picture because you might hear the term glossitis, and it doesn't always mean you have some type of anemia. We are talking about atrophic glossitis. That's the one pictured here with the arrow, and that's what the tongue looks like. There's all kinds of different like tongue inflammation. Okay, so assessment and nursing priorities. If a patient presents with signs of anemia, we have to figure out which one, because it could be like a blood loss anemia, and we want to look for sources of bleeding, or it could be like iron deficiency anemia. So it's all about getting a health history and asking a lot of questions and doing a good head to toe. We are going to monitor their H&H, their hemoglobin, and hematocrit. Remember, that's a really good, that's going to tell us if they're anemic. Bleeding, ask them, do you see any blood in your stool and your urine? Did you vomit? Is there blood there? Educate on diet. So we're talking about iron deficiency anemia, so we're going to encourage iron-rich foods, red organ meat, beans, green leafy vegetables, shellfish, fish, iron-fortified cereal and bread for those that don't like any of those things, especially children. That's a really good source to offer. We want to educate our patients on medication. Education is so important, especially here because iron supplements have a couple of side effects. So you don't want the patient to get scared and, call their doctor or go to the emergency room because they weren't expecting this to happen. So iron supplements are best absorbed in an acidic environment. So an empty stomach, or even better, with vitamin C like orange juice. It helps the absorption of it. If you give undiluted iron, it can stain the teeth, so you just want to let your patients know that, and they should be drank through a straw. It also can cause GI upset, the oral form of iron. It can cause heartburn, it can cause constipation or diarrhea. So for the constipation part, we want to make sure that they know that so they can increase their fluids, their fiber, and of course activity level if possible. And most importantly, iron can cause your stool to change color into dark green or dark black. So you want to tell your patients this because they may get scared when they look in the toilet and they see black stool. Now, this is not to be confused with tarry stool, black tarry stool. That is not normal, and we think GI bleed with that. So we're not talking about sticky, thick, dark stool. We're just talking about a color change. Parenteral iron. So this is not oral route. This is like IV, intramuscular. And sometimes patients don't have, maybe they had intestinal surgery, they just don't have the ability to absorb it in their GI tract, so this would be a good reason to give it IM or IV. Or maybe they just cannot tolerate the oral form. It doesn't matter what they try. Maybe they did try to take it with food. It just causes too much GI upset. Then we're going to give it to them, IV or IM. Or maybe their iron levels are so low, they have to get the IV, a faster route. Or poor patient compliance. Maybe we have, grandma that's iron deficient and we send her home with the plan, but she just doesn't follow the plan. Then she might be, better off getting IM or IV. And a little note, IM may stain the skin, so we would prefer the Z-Track method to kind of mitigate that. Our final nugget on iron deficiency anemia. So IDA is common, often preventable, and highly manageable with the right education and intervention. So as nurses, make sure you catch those early signs, you educate patients on their diet, medications, and preventing complications. Thanks for watching. If this helped clarify things for you, be sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.